Leukemia is a cancer of the blood or bone marrow, which produces blood cells. Leukemia occurs due to a problem with blood cell production. It usually affects the leukocytes, or white blood cells. Causes: leukemia develops trusted source when damage occurs to the DNA of developing blood cells, mainly white cells. This causes the blood cells to grow and divide uncontrollably. Usually, healthy blood cells die after a while, and new cells develop in the bone marrow and replace them. In leukemia, the blood cells grow too quickly. Trusted source do not function effectively, and do not die at a natural point in their life cycle. Instead, they build up and occupy more space. As the bone marrow produces more cancer cells, they begin to overcrowd the blood, preventing the healthy white blood cells from growing and functioning normally. This also affects the platelets and red blood cells. Types: doctors classify the different types of leukemia according to 1. The type of blood cell they start in. 2. Whether they are acute, grow quickly, or chronic, grow slowly. 3. If they occur in a child or an adult. Chronic and acute leukemias. In acute leukemia, developing cells multiply quickly and collect in the marrow and blood. A blood test will show that more than 20% trusted source of blood cells are blasts. This means they're immature, having exited the bone marrow too soon, and are not functional. Chronic leukemia progresses more slowly. It allows for the production of more mature, useful cells. In a blood test, fewer than 20% of cells are blasts. Lymphocytic and myelogenous leukemias. Lymphocytic leukemia occurs if cancerous changes affect the type of bone marrow that makes lymphocytes. A lymphocyte is a white blood cell that plays a role in the immune system. Myelogenous leukemia happens when the changes affect bone marrow cells that produce blood cells rather than the blood cells themselves. Common types. There are several types of leukemia. They include acute lymphocytic leukemia. Children under 5 years. Trusted source have the highest risk of developing acute lymphoblastic leukemia, or. However, it can also affect adults, typically over the age of 50. Around 60% of cases are in children. Chronic lymphocytic leukemia. Chronic lymphocytic leukemia, CLL, mostly affects people over 70 years. Trusted source of age, but younger adults can also develop it. About 25% trusted source of new cases of leukemia are CLL. It is more common in males than in females and rarely affects children. Acute myelogenous leukemia. Acute myelogenous leukemia, AML, is more common trusted source in adults than children and is more likely to affect males than females. Overall, however, it is rare. Chronic myeloid leukemia. Chronic myelogenous leukemia, CML, accounts for around 15% trusted source of all leukemia cases in the US. It is rare in children. Hairy cell leukemia. Hairy cell leukemia, HCL, is a rare type of leukemia that mostly affects adults in middle age and older. In the US, there are around 1,000 new cases each year. It is chronic and tends to be slow-growing. It gets its name because, under the microscope, the cancer cells have fine, hair-like strands. Symptoms. Symptoms of leukemia vary according to the type. They include the following. 1. Easy bruising or bleeding. Leukemia affects the platelets in the body, making it harder for blood to clot. 2. Frequent infections. The white blood cells are crucial for countering infection. If white blood cells do not work correctly, a person may develop frequent infections. The immune system may attack the body's own cells. 3. Anemia. As fewer effective red blood cells become available, anemia may develop. This happens when there is not enough hemoglobin in the blood. Other symptoms. Other possible symptoms are trusted source. 1. Nausea. 2. Fever. 3. Bone pain. 4. Weight loss. The symptoms of leukemia can all occur with other conditions. Anyone who has concerns about symptoms should seek medical advice. A doctor will carry out tests to identify the cause. Diagnosis. A doctor will most likely 1. Carry out a physical examination. 2. Ask about personal and family medical history. 3. Check for signs of anemia. 4. Feel for an enlarged liver or spleen. 5. Take blood trusted source for testing in a laboratory. If the doctor suspects leukemia, they may suggest a bone marrow biopsy. A surgeon extracts bone marrow from the center of a bone, usually from the hip, using a long, fine needle. Treatment. Treatment options will depend on 1. The type of leukemia. 2. The person's age. 3. Their overall health. The treatment options trusted source a doctor may recommend include 1. Watchful waiting for slow-growing leukemias, such as Calais and HCL. 2. Chemotherapy. 3. Radiation therapy. 4. Targeted therapy. 5. Immunotherapy. 6. Bone marrow transplant. 7. Surgery to remove the spleen. 8. Stem cell transplant with chemotherapy. A cancer care team will tailor this to suit the type of leukemia. Treatment that starts early is more likely to be effective. If you know something extra about this, then comment below, because this will be helpful for us. At the end, it is requested to please subscribe our channel.